Hello everyone, this is Monica Lou, and I wanted to share my experience with the detached retina after cataract surgery. This is by no means medical advice. I'm just sharing what happened to me. Back in the summer, my ophthalmologist told me that he could no longer correct my vision to make me see any better, that I would have to consider having my cataracts removed. So I went for a second opinion and a third opinion, and I was at high risk for retinal detachment. My retinas on the end are very thin, and I've had a detached retina in my right eye back in 2011, and now it's 2019. But my vision was getting so poor that I decided I would go ahead and have cataract surgery done. Well, I went to an ophthalmologist who does cataract surgery, and they scheduled me on November 20th. I had my right eye done. Surgery is painless. The hospital was great. Afterwards, the post-operative recovery is pretty painless as well. You have to put drops in for several weeks and adhere to that schedule so that you don't get an infection. 2 weeks after the right eye was done, I had my left eye done, and I guess they break up the cataract and vacuum it out and insert a lens, and you can see out of your eyes. You can really see very clearly. Then about 5 weeks after my left eye surgery, my retina detached. So I went to the retina specialist. I went to my cataract guy, and he said, go to the retina specialist. And I had been seeing a retina specialist since 2011 in preparation for any future detachments. The procedure that they do is a bubble is injected into your eye, and this bubble helps press the retina back in place. The procedure in the office, of course, is actually pretty painless. It's scary more than it is painful. Your eye is numbed. You have lots of drops put in there, lots of numbing medication. It's a quick procedure. It's inserted in your eye. Then the retina specialist placed a cover over my eye. It was sort of out of cardboard-like material, and he drew an arrow on it so that, in my case, I had to lean to the right and lean forward, and that got the bubble in position over the tear, the retina tear. And I was to stay in that position once I got home until the next day when I came to the office. So the arrow is so that if you have someone at home that can help you, point the arrow toward so that it's up. My husband was pretty good at keeping the arrow up in the air, so that worked out pretty well. The next day when I went to the office, I got in what they jokingly call the hot seat. It's because you're having a laser, and lasers are hot. So you lay down in the chair, the retina surgeon takes the laser and cinches down around the hole, so that around the tear, to help the retina stay in place. Then you go home and put your head in position, and you're supposed to be doing this for the next week. you can get up about 5 minutes every hour, and you really need to stay in position. I read the first time when I had this happen, I read that the bubble does work. It will help you to reattach your retina, but you need to stay in position, and it is very tough. Your neck aches, your back aches, you're going stir crazy, you're ready to just jump out of your skin. But you have to stick with it. By the third night, I just was so tired I fell asleep and I slumped forward, but it didn't seem to affect my progress. Let's see, the bubble was inserted on a Thursday. Friday, I went for my laser treatment. Monday, I went back for a checkup. Things were progressing as they should. Still detached, but still progressing. Nothing worse. Then by Thursday, which was a week, when I was at home, I felt something different. I felt like something happened in my eye. My vision cleared up a little bit. And I just felt like something good was happening. So Friday I had my appointment, and I went in, and he said the retina had reattached. The bubble was over 50% decreased in size, and he said I didn't have to sit in position if I did not want to, but I could. It wouldn't hurt. I elected to go home and sit in position that day and Saturday. By Sunday, the bubble was gone. I figured I have the bubble. It's there to help me, so I'm going to use it while it's there because I don't want to get another one. So things were going along good. And then I experienced in my other eye, which is the right eye, which is the one that was detached in 2011, I experienced an increase in flashes, and I couldn't tell if I had more floaters because I have 100 floaters in that eye to begin with. So I went to the retina specialist, and he said I was having PVD, posterior vitreous detachment. That normally occurs, oftentimes occurs in older people like myself. I'm 66, where the vitreous gel pulls away, and if it doesn't pull away clean, it can keep tugging on that retina and create a tear. So I didn't want that to occur. There's really nothing that can be done for that except stay still as much as possible and pray. Hope that it detaches cleanly. So since then, I have been home. I am doing very little. I'm wearing my glasses so that the light doesn't bother my eyes. The retina specialist said that I should watch TV. When you watch TV, you focus on a smaller area and it's in the distance, and your eyes do not move around as much. I was surprised at that. I thought that watching the action on the TV would move your eyes, but it doesn't. He said reading and close computer work, that all uses your eyes, moves them around, and that's what you want to avoid. He also said I was to avoid any kind of strenuous lifting, aerobics, strenuous exercise. So I'm doing as little as possible, and I'm watching TV, sort of. Well, I live out in the country, and we don't have cable because cables don't come out here. So we have over-the-air TV, which is pretty limited, but it is what it is. So anyhow, as I said, this isn't medical advice. This is just my experience, and maybe someone can get a piece of information that might help them in their recovery from cataract surgery, retinal detachment, and thought I would share it with you. Thank you, and I want to remind everybody to take care of yourself.